Here we are, it's part 2 on page 694, and we're dealing with blood vessels in the cardiovascular system. So this entire chapter is about blood vessels. And we just did an overview along with the beginning here of the arterial system. And we have an arteriole now. An arteriole is the outflow from the artery that serves a capillary bed. So the purpose of arterioles is to guide blood to specific capillary beds, and then also what is not identified here exactly is that there is a little sphincter here, which is activated by the parasympathetic and sympathetic nervous systems. So in general, we have receptors and little sphincters here that guide the blood. In some cases, we can have blood pass through the middle and not go out into the business district, so to speak. So it just bypasses everything. Or we can have a more substantial perfusion. The word perfusion means how much blood is going into the tissue. Some tissues are highly perfused, some tissues less so. Some tissues can vary quite a bit. Okay, so if this was an area of muscle and the muscle was active, we would have this being highly perfused. If it was a digestive tract area and we were in a quiet, seated position and ingesting food and enjoying beverage and so on, and maybe fine company, then this would be the ideal setting for an increased perfusion at the digestive level. Okay, and I indicated before that there's going to be cells out here that are being served by the capillary. The purpose of the capillary is Meals on Wheels. We're going to be serving in situ tissues throughout the body, every part of the body. Even when you have a little tiny paper cut on your finger, and it seems hardly very invasive at all, yet you see blood form from that little tiny cut. Possibly even a drop of blood will form, which means you've cut through some capillaries. So they're really everywhere, and they're serving every cell of the body. Okay, at least by diffusion, if not by more direct means. Okay, so we come over to the venous side here, and we've pretty much used up all the pressure. We've come from maybe 55 millimeters of mercury here, all the way down to between 10 and 15 millimeters of mercury here. So we've pushed out the nutrients, and then by osmotic means, we've taken back up the waste products. That's going to be something that we look at very specifically with numbers. Okay, the venule here is the very beginning of the pathway that guides capillary blood back to a vein. And here is the vein. The walls, if you were to compare the structures here one to another, you'll see that there's a lot more lumen here than there is here. And these are thicker walls, not much lumen. Here we have thinner walls, huge lumen, okay, as indicated in the photomicrograph that we went over in the previous section. Okay, so just to let your eyes look at that one more time. Small lumen, big wall, huge lumen, small wall. This is a low-pressure system. It needs a little bit of structure here, starting from the tunica intima. We still have endothelium. We still have a sub-endothelial layer of loose connective tissue. So that's still part of the program. What's happening here in addition is that we have a valve. And under pressure, it's a one-way valve, which means that blood can flow back toward the heart. But if there's any pressure from this side, if you're leaning on your arm, or you've got something gripped in your hand and you're pressing on a vein, then it's not going to go backwards. These cups will fill here and will close the valve and prevent backflow or reflux. Okay, then moving on, we have our Tunica Media. Again, it's going to be smooth muscle, very little in the way of elastic lamina. We're going to have a very substantial, and the large veins like the inferior vena cava, superior vena cava, we're going to be having substantial vasa vasorum, which is to say lots of little arteries and veins that are going to perfuse the tunica externa and provide nourishment for the walled structure here. Okay, and then again another big overview that brings us to the systemic circuit. Remember, when we have the heart, we're also sending blood up into the lungs, the pulmonary pathway. Here we're mainly looking at the from the aorta onward to basically nourishing all the cells of the body. So this is not about capturing oxygen, which is what we would do if we were going to the lungs. This is about feeding cells and cleaning cells. So feeding and cleaning. If you're a parent, you know exactly what I'm talking about. Feeding and cleaning. Okay, so in essence, we have way too many children. We have 40 to 50 trillion of them. And that's our job, is to nourish and clean all of those children. So you can see the big overview here. You can see that we can have a bypass, as it were, and come across this way. We can go deep into the tissue and perfuse it with necessary nutrients. Okay, so there's a wide variety of things that we can accomplish here. Here they're also looking at the sphincters. Take a look at that. We have a terminal arteriole, which means this is going to be guided by the parasympathetic and sympathetic nervous systems in order to guide how much blood flow there is to this tissue. Okay, so we call this a precapillary sphincter. They're all around. Notice that we're also being served, and in the next chapter we're going to look closely at the lymphatic system. So that's a sister system here, and we come back up this way, and we're going to be having lots and lots of increasing in size structures. Okay, out here we have branching structures that become smaller and smaller. On the way back we have tributaries that lead to larger and larger structures. Okay, so down here in the text we're going to be addressing two major types of arteries, the elastic arteries versus the muscular arteries. The elastic artery is actually a feature that is unique to the aorta itself. It is the aortic arch is like an elastic balloon. If you can imagine breathing into or blowing into a balloon at a party and blowing up that balloon. With some effort, you can get the balloon to enlarge and tie it off. Also, in any system in which we have tall buildings and we have plumbing, we need to have a kind of compressor in which we receive pressure and water that gets somehow doled out between the many, many floors of the building. So it is a feature of plumbing in general that we have this need to maintain blood flow. So the heart is having a stroke volume, a discrete flow of blood under pressure, and multiple times per minute. Okay, so that means that many, many times per minute, the arteriole, the aorta is actually increasing in size and taking on this large bolus of blood. Then the heart relaxes, it's in its diastole, and there's a recoil of the elastic tissue here, and the blood moves on. Then there's a new systole and a new increase in the size of the aorta, and then a recoil as the heart relaxes and the blood moves on. So with each heartbeat, we have that situation where we have to have something elastic here to take that bolus, that large amount of volume, and then allow it to have its continuous flow maintained, because I've pushed open against pressure, and then that pressure is returned upon the recoil. Okay, so if we flip the page here, we'll see that the arteries are described. So here is a elastic artery, and here is a muscular artery. Notice that this artery has a large lumen, and it has a significant amount of elastic fiber. This considerably less so, and considerably more smooth muscle. Okay, so the mix is different. This is a very, how shall I say, small part of the mix. And we'll pick up this this idea and this particular table in our part 3 coming right up.